ask them how the audio is?
I want to introduce our first speaker at this morning's rally on behalf of PEPFAR. That's Matt Kavanaugh, who is a law professor at Georgetown University.
PEPFAR saves lives around the world. 20 million people living with HIV are dependent on the PEPFAR program, and this administration has shut it down. That is shameful. The important thing to know about that is that this administration does not have the legal authority to do so. Marco Rubio is the Secretary of State. He is not the President of the Congress. He is not the King of the world. He is not the Supreme Court. He is not God.
No, he is not.
20 million people living with HIV deserve their medicines. AIDS drugs now! 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 So look, in the United States, we have a Constitution. And the Constitution says, in Article 1, you don't have to read very far. Article 1 of the Constitution says that Congress shall make the laws. And the law says, number one, that those 20 million people, they get their AIDS medicines because Congress appropriated the money. Number two, it says that the PEPFAR program is something authorized by Congress, and the administration is not legally allowed to try to kill it.
Talk about it!
Number three, it says that the Congress established the United States Agency for International Development, and it is not up to the president, it is not up to Elon Musk, and it is certainly not up to Marco Rubio to try to cancel it or abolish it. People with AIDS are always on the front lines, are always the bellwethers for what administrations look like when they are trying to kill people instead of save lives. We have been here before, we know what this looks like, and we know that it does not stop at people living with HIV. It does not stop at trans people. It does not stop at black and brown bodies around the world who are going to get shut down and denied their access to the medicines they need to live. That's not where it's going to stop. But we also know that this administration does not have all the power in the world. And in fact, what we see is that they are a relatively weak administration. Donald Trump won less than half of people who voted, who live in the United States. He won less than half of people who voted, and less than half of people voted. That means that this is a minority government. And we know that the Constitution establishes checks and balances. The first check on that is Congress. And so we call on Congress to use your authority. Back up the words that you passed in law. We call on the Senate to take action, to haul Elon Musk in front of them, to explain exactly why he thinks he can deny AIDS drugs to people. We call on the House of Representatives to hold hearings immediately, to understand why is it that an unelected billionaire is the one trying to take control of our government and trying to take AIDS drugs away from people. We call on the administration to follow the law and follow the Constitution, not follow the whims of Twitter trolls. Everyone around the world to recognize that the biggest check on the power of our government is the people of our country. And so we know that in fact we will not stand for tyrants. We will not stand for people who want to deny people AIDS drugs. We will not stand for people who
go.
Here on a happier occasion. But at least we do know that us being here is a step in the right direction.
Yes.
Of letting the Trump administration know that PEPFAR, USAID, and other generously U.S.-supported global health programs are not only critical, but essential parts of public health security.
That's right.
I am here for the 35 million people whose lives and families have been saved by PEPFAR. I am here for the 20.8 million people who currently relies on PEPFAR to get life-saving HIV treatment. I am here because PEPFAR made me so proud of my countries, ranging from Botswana to South Africa. PEPFAR's investment in the global HIV response has helped bring life-saving HIV treatment to countless communities across the globe. It is one of the fucking good things that America has ever done. And I am pissed off to see leaders to try to destroy it. I am here because every person living with or has been affected by HIV deserves access to quality life-saving care, both here in the United States and across the globe. I want everyone to know that Americans care about PEPFAR. And we will not stand by while it's under attack. I am here because AIDS activists fought like hell for life-saving treatments we have today. And I am here to say that we will not go back.
No way.
And until the Trump administration knows how important and ignore the blatant bullshit that folks are spreading about PEPFAR, USAID, and all other programs, we will stand out here day and night advocating, talking to our members of Congress, giving them pressure to ensure they do their damn job. And so in closing, may this fight not be the first fight, but it is one of the many fights we shall always hold strong, because when we get shit done, the world becomes a better place. Restore PEPFAR now! 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 Restore PEPFAR. Our next speaker is the well-known actor Javier Munoz.
Hi everybody, Javier Munoz. I'm a Broadway actor. I'm also an activist. In 2002, I tested positive for HIV. It took me 3 years to find my courage and my strength to live openly with my status, because I knew we had to fight to make a difference to save more lives. My activism began, like so many of you, with the loss of our friends and loved ones while the Reagan administration sat by and did nothing. It continues Because the love of my life died in my arms at what was St. Vincent's Hospital.
Yes.
Yes, it was. I'm angry, y'all. I'm sorry. I need a minute.
Take a deep breath.
My work continues.
Come on, baby.
Through my work, I have had the great privilege to travel this world to other countries and see on the ground firsthand the impact of this work globally. I'm going to cite one example. I met a couple, both of them HIV positive, alive because of access, consistent, affordable, equal access to treatment.
Talk about it. Right.
They discovered through their treatment that their hope to have a family was not dead. I got to meet their little girl who was born HIV negative, because in parts of this world, access to treatment means zero transmission from mother to child. We have gotten there because of what we are doing, because of PEPFAR, because of USA.
Yes.
We all know what it means when access to treatment is denied. It means people die.
Yes.
That blood is on your hands.
Yes.
Trump, Rubio, that blood is on your hands.
Right.
Every single day that this stays frozen. I'm talking directly to you, Secretary of State Marco Rubio. I know your heart. You know I know your heart. Through this work, I have seen what you've done. I know you know better. And I know you should be doing better. And that's got to start today. Lives must be saved today.
That's right.
I'm going to leave you with one thought, and it's through this work, this wonderful work that I've done. I've gotten to work side by side with Bono. Bono, who helped create PEPFAR. And he says, where you live should not determine if you live. And that is true. So we continue to fight. Thank you for allowing me to speak. Trump has blood on his hands. 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 Trump has blood on his hands.
I'd like now to introduce the Executive Director of HealthGap, Asia Russell.
Good morning, everybody. Housing Works, good morning. Treatment Action Group, good morning. We are here today because we will not allow the one shred of decent work by George W. Bush to be dismantled by genocidal lunatics in this administration. I have to speak openly and honestly to you today. PEPFAR has saved lives because of the work of duty bearers, people with HIV around the world and in the United States. 25 years of diplomatic work we can be proud of as Americans. And to think, after 2 weeks in the White House, this administration wants to dismantle a life-saving program. We will not allow it. 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 Today, we know every single moment this unjust and illegal stop work order on PEPFAR is in place. Hundreds of people go without medicine. Thousands of people go without access to testing and counseling.
administration wants to review aid. Well, first of all, they can start with reviewing the Department of Defense budget. But we already know PEPFAR is one of the most high-impact, data-driven programs there is. It's all on the web, except, whoops, they took that down too. Not only that, but PEPFAR is driven by human rights, by a commitment to fund programs led by lesbian, gay, bisexual, trans, and queer people across East and Southern Africa and Eastern Europe, by drug users, by sex workers. Why? Because we believe in human rights. And we force Republicans to believe in human rights too. And you know what? It's also science. So even if you don't care about morality, the evidence speaks. The data don't lie. And in order to do effective HIV programming, you have to invest in the communities that are most affected. So we're not going to stand by while they attempt to dismantle this $7.25 billion program. Because we'll stand up and say we're proud to pay our taxpayer dollars to save lives. We are proud because we know it actually does keep America more safe, more secure, and more prosperous, because it keeps the world safer and more prosperous and more secure. So even by their bogus tenets of so-called aid review, we pass with an A++. So it's time, Mr. Rubio. Lift the freeze on PEPFAR. 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 With 20.6 million people sustained on life-saving antiretroviral treatment around the world, 80 million HIV tests, hundreds of thousands of people who are able to deliver safely a baby who is HIV negative and breastfeed safely so that baby remains negative. This is exactly why we need taxpayer dollars to invest in life-saving programs. This administration not only wants to freeze life-saving work, they want to dismantle the program forever. So I want everyone to know, you woke up today and you said, I'm going to put my body on the line, even if it's raining, even if Montgomery County schools are delayed by 2 hours. It doesn't matter. So thank you, but you need to know, it doesn't end today. It can't end today. You know why? Because after this unjust and illegal and deadly 90-day freeze, guess what's coming next? They're going to try to take away PEPFAR altogether. Or they're going to try to make it into some non-evidence-based, abstinence-only, being faithful program that rejects the leadership of trans, queer, sex worker, and drug-using communities. And we won't stand for that. That ain't right. So I need to know, Rubio, hands off PEPFAR! 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 Hands off PEPFAR!
And we got a slight change of plan, and I'll tell you about that in just a minute. But before I do, I just want to say a few things from the heart. So, I'm a little bit older than some of the people, not all of the people here. And I remember what it was like in the mid to late 80s in New York City, where I lived, and in New Haven, where I lived, where death clung to us like a stench we couldn't get rid of. I remember seeing someone who looked just fine one day, and the next day he had a Kaposi sarcoma lesion on his forehead. I remember seeing a person who looked fit and healthy,
only to see them a week later weighing 20 pounds less. I remember the summer in 1989, where, count them, I attended over 50 memorial services for friends who had died of AIDS. That is what our lives were like back then. And we had a cruel president at the time who could not even say the word AIDS, could not bring himself to utter it. Yep. And people thought AIDS was God's way of taking care of those of us who are homosexual. Well then, in the mid-90s, we saw the development of triple combination therapy ARVs. And to be honest, at first in the United States, you could get access to it only if you had health insurance. But later there were programs rolled out like Erupt that gave everyone in the United States access to ARVs. People in Western Europe had access to ARVs. But every time people like me took our ARVs, we had a twinge of guilt because we knew that in other countries around the world, in low-income countries, people were still dying because they didn't have access. And that's why I said thank God for George W. Bush, because he introduced the President's Emergency Plan for AIDS Relief, and because of his action, over the last 22 plus years, the United States has invested over $100 billion, of which has saved now 26 million lives around our world. And placed right now, 2 million people on pre-exposure prophylaxis so they don't run the risk of getting HIV. Now those numbers sound big, and maybe numbers move you, but if numbers don't move you, let's talk human beings. Housing Works has an office in Haiti, and just last week, I received a text from one of our employees. He wrote me, please, I only have 2 weeks of medication left. When you come to Haiti, can you bring me anything that I can use? I received a text from a friend of mine in Uganda. His name is William. He champions U equals U. He wrote me. He said, I just learned I've been laid off my job doing HIV prevention education to Ugandan youth. And I'm in a very few weeks going to run out of my own treatment. I'm trying to figure out how to tell my wife that I've lost the only income my family has, and also to tell her that I'm probably going to die of AIDS. That is what we are doing in low-income countries around the world, and that is exactly why we need to fight back. Now then, I'd invite people to gather in close, because I don't want to use the mic for what I have to say next.
Oh, sorry.
So, as it turns out, the police figured they've got us nicely in a cul-de-sac. They're like, there's other entrances the vehicles can use to get here, so we're not going to do anything. And you know what? If you go sit under the awning and block people from going into the doors, there's other doors they can use, so we'll be happy to leave you there all day. So we decided we're going to do a bit of a change of plan. So those of us who are going to do civil disobedience are going to get on the banners and right behind the banners. And we're going to be marching back down 22nd Street. And we're going to be marching into Constitution Avenue. And this banner I'm leading is going to face that way and block the traffic. And the other banner is going to face that way and block the traffic. And those of us who are going to do CD are just going to hang out in the street and have a good old time.
I'm sure.
Those of you who don't want to risk CD, if you want to follow us in the street until the police tell you to disperse, you're welcome to do that. Otherwise, you're welcome to stand on the sidewalk and keep chanting. If you're not planning to risk arrest, watch the marshals who have the vests on and follow their instructions. Now, I'm holding two mics that belong to somebody, and I wanted to make sure they don't go to jail with me.
Mike's in jail.
Who's responsible for these mics?
Yeah, this might say.
Thank you. Okay. Let's see. How about, anyone need to know what this said? Rubio, Trump, blood on their hands.
Yeah.
Like that good? Yeah. Okay, if y'all will part right here so we can get started. Rubio, Trump, blood on their hands. 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 Blood on their hands. Rubio, Trump, blood on their hands. Blood on their hands. Rubio, Trump, 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 blood on their hands. Blood on their hands. Rubio, Trump, blood on their hands. fight back. We fight back. The lanes are under attack. We fight back. We're under attack. We fight back.
People laid on attack.
What do we do? What do we do? Get that fight back! Get that fight back! Get that fight back!
We fight back.
We cannot fight back! We cannot fight back! We cannot fight back!
Under attack! People with AIDS are 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 under attack! People with AIDS is under attack! People with AIDS are under attack! People of AIDS is under attack! People of AIDS are under attack! People of AIDS is under attack! People of AIDS is under attack! People of AIDS is under attack! Hands off PEPFAR! 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 Hands off PEPFAR!
I don't have any way to set it up because I can't let go of my camera to set it up.
Hands off
You
PEPFAR!
can probably just talk to him. You
PEPFAR!
want to talk to him right now? Walk up and talk to him.
Hands off PEPFAR!
What's going on right now?
We're blocking an intersection to let Donald Trump and Secretary of State Rubio know that they need to let PEPFAR funding flow.
Are you willing to be arrested?
Of course, absolutely. People are dying for lack of treatment, so we're absolutely willing to get arrested to ensure that they get access to treatment that they really need. Hands off PEPFAR!
How that audio
Hands off
works.
PEPFAR! Hands off
And then if not, I'll have you hold this for a second while I set up the mic.
Hands off PEPFAR! 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 Hands off PEPFAR, Rubio! Hands off PEPFAR! Hands off PEPFAR! Hands off PEPFAR! Hands off PEPFAR!
It's okay.
I'm gonna stay on that side. Once they go over there, I'm gonna stay over there. Thank you.
Yep, no problem.
Hands off PEPFAR! Hands off PEPFAR!
I've been booted. Okay. So what was the audio okay? Because I can hook up a mic, but I'm just gonna have to get you to get this stuff out of there for me.
We bought this program. You take your hands off it.
Unfortunately, I got a mono. But I just got to get my camera ready. Where are they? I wish I was on the other side. I don't know. We can try. They're gonna come get these guys too. That's what I was thinking. Was if you know. Oh, I see what you're saying. Yeah, yeah. Kind of sucks being over here. I think I want to. If they started arresting them in the middle, I'm going to run out to that island. Yeah. Was the audio okay on that interview? Oh, well, we can hook up a microphone. I mean, it's in the bag and the cable's in there. I'm not sure what it's going to sound like. I I haven't had a chance to put headphones on. You know, we just hit the ground running, and I couldn't hook anything up.
PEPFAR saves lives. Rubio kills. 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 PEPFAR saves lives. PEPFAR saves lives. Rubio kills. PEPFAR saves lives. Rubio PEPFAR saves lives. PEPFAR saves lives. Rubio kills. PEPFAR saves lives. Rubio kills. PEPFAR saves lives. PEPFAR saves lives. Rubio kills. 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 PEPFAR saves lives. PEPFAR saves lives. Rubio kills. 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 PEPFAR saves lives. PEPFAR saves lives. Rubio kills. 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 PEPFAR saves lives. Trump kills. PEPFAR saves lives. Trump kills. PEPFAR saves lives. Trump Trump, Rubio, and the blockade. You're killing. And the blockade. You're killing people with AIDS. Trump, Rubio, and the blockade. You're killing. Trump, Rubio. You're killing.
Did you ever hear anything about the audio okay?
You're killing. Trump, Rubio, and the blockade. Trump, Rubio, and the blockade.
Okay. Okay, cool. Okay.
You're killing. Trump, Rubio, and the blockade. You're killing. Trump, Rubio. You're killing. Trump, Rubio, and the blockade. Trump, Rubio. You're killing. Trump, Rubio, and the blockade. Trump, Rubio, and the blockade. You're killing. Trump, Rubio. You're killing. Trump, Rubio. You're killing people with AIDS. Trump, Rubio. You're killing people with AIDS. Trump, Rubio. You're killing. 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 Trump, Rubio in the blockade. Trump, Rubio in the blockade. You're killing. Trump, Rubio in the blockade. You're killing. Trump, Rubio in the blockade. You're killing. Trump, Rubio in the blockade. Trump, Rubio in the blockade. You're killing. 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 Trump, Rubio in the blockade. Trump, Rubio. Trump, Rubio. You're killing. Trump, Rubio. You're killing. Trump, Rubio. You're killing. Trump, Rubio. You're killing. You're killing. Trump, Rubio. Trump, Rubio. You're killing. People with AIDS. And the blockade. People with AIDS. You're killing. Trump, Rubio. You're killing. Trump, Rubio. Trump, Rubio. You're killing. Trump, Rubio. You're killing. Trump, Rubio. You're killing people with AIDS. 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 Trump, Rubio. You're killing. Trump, Rubio. You're killing.
Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, you're killing. Trump Rubio, Trump Rubio, you're killing. Trump Rubio, Trump Rubio, you're killing. Trump Rubio, we are killing. Trump Rubio, you're 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 killing. Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS! End the blockade!
You're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS! End the blockade!
You're killing.
People with AIDS!
Trump Rubio,
End the blockade!
you're killing.
People with AIDS!
Trump Rubio, you're killing. 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 Hands up,
Huh?
PEPFAR. Hands up, PEPFAR.
Really?
Hands up, PEPFAR.
Wow.
Hands up, PEPFAR.
It's not, it's the rain cover.
Trump and
Yeah.
Rubio, hands up, PEPFAR. Hands up, PEPFAR. Trump
take it
and
off.
Rubio, hands up, PEPFAR. Trump and Rubio, hands up, PEPFAR. Trump and Rubio, hands up, PEPFAR.
Trump and Rubio!
Trump and Rubio. Trump and Rubio. Trump and Rubio. Trump and Rubio, you're killing people with AIDS. Trump and Rubio, you're killing people with AIDS. Trump and Rubio, you're killing people with AIDS. Trump and Rubio. Trump and Rubio, you're killing people with AIDS. Trump and Rubio. Trump and Rubio, hands on PEPFAR.
Sorry, it's the rain cover. It's popping in there.
Trump and Rubio, hands on PEPFAR. Rubio, hands on PEPFAR. Trump and Rubio, hands on PEPFAR. Rubio, hands on PEPFAR. Hands on PEPFAR. What do we want? PEPFAR. When do we want it? Now. What do we want? PEPFAR. When do we want it? Now. What do we want? PEPFAR. When do we want it? Now. Yesterday. What do we want? PEPFAR. When do we want it? Now. What do we want? PEPFAR. When do we want it? Now. What do we want? PEPFAR. When do we want it? Now. People with AIDS are under attack. What do we do? If people with AIDS are under attack, what do we do? Stand up, fight back. People with AIDS are under attack. What do we do? Stand up, fight back. What do we do? Stand up, fight back. People with AIDS are under attack. What do we do? Stand up, fight back. If people with AIDS are under attack, what do we do? Stand up, fight back. If people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up. When people with AIDS are under attack, what do we do? Stand up. When people with AIDS are under attack, what do we do? Stand up. When people with AIDS are under attack, what do we do? Stand up, fight back. What do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. When people with AIDS are under attack, what do we do? Stand up, fight back. Stand up, fight back. Stand up, fight back. PEPFAR saves lives. Rubio kills. 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 Rubio kills. PEPFAR saves lives. 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 PEPFAR saves lives. Rubio kills. 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 PEPFAR saves lives. Kills. PEPFAR saves lives. Rubio 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 kills. PEPFAR saves lives. PEPFAR saves lives. Rubio kills. PEPFAR saves lives. Rubio kills. PEPFAR saves lives. Kills. PEPFAR saves lives. Rubio 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 kills. PEPFAR saves lives. PEPFAR saves lives. Rubio kills. PEPFAR saves lives. Rubio saves lives. saves lives. Rubio kills. PEPFAR 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 saves lives. PEPFAR saves lives. Rubio kills. PEPFAR saves lives. Rubio kills. Hey, hey, ho, ho. AIDS got to go. 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 Hey, AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to
Kind of starting to
go. Hey, hey, AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Ho, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey, ho, ho. Got to go. Hey, hey, ho, ho. Hey, hey, ho, ho. Got to go. Ho, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey, ho, ho.
this bag.
AIDS
So
got
you just
to
keep an eye on
go.
it right
Hey,
there.
hey, ho, ho.
I just want to get so I can actually get them in
Hey,
the
hey, ho, ho. AIDS got to go. Hey, 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 hey. AIDS got to go. Hey, hey, ho, ho. 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 AIDS got to go. Hey, hey,
All right, I got it.
AIDS got to
You
go.
want to just
Hey,
hang
hey,
on to this?
ho,
Yeah,
ho.
cool.
AIDS got to go. Hey, hey,
Yeah.
ho, ho. AIDS got to go. Ho, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey,
I'm
hey,
trying to do this and
ho,
not
ho.
lose the shot.
AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey.
To do an interview? No, we can do it. But let me set it up first before you. I'm gonna have to get my headphones out of here.
Hey, hey, ho, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey. AIDS got to go. Hey, hey, ho, ho. 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 AIDS got to go. Ho, ho. AIDS got to go. Hey, hey, ho, ho. AIDS got to go. Hey, hey. AIDS got to go. Hey, hey. AIDS got to go. Ho, ho. AIDS got to go. Hey, hey. Ho, ho. AIDS got to go. Hey, hey. Ho, ho. AIDS got to go. Hey, hey.
Ho ho! AIDS cuts have got to go. Hey hey! Ho ho! AIDS cuts have got to go. Hey hey! Ho ho! AIDS cuts have got to go. Hey hey! Ho ho! AIDS cuts have got to go. Hey hey! Ho ho! AIDS cuts have got to go. Hey hey! Ho ho! AIDS cuts have got to go. Hey hey! Ho! AIDS cuts have got to go.
Hold on. Hold on a second. Okay.
PEPFAR saves lives. PEPFAR saves lives. PEPFAR saves lives. PEPFAR saves lives. PEPFAR saves lives.
Check 1 2. Mic check 1 2. Test 1 2. Test 1 2. Test 1 2. Check 1 2. Check. Channel 1. I'm gonna.
And you'll be looking at me. You're live. We're live right now.
Go ahead.
Okay. All right. So tell us what's happening.
So right now, AIDS activists from across the United States have actually converged right here in Washington, D.C., outside the State Department to protest the cuts that are happening and the freezing of money for HIV around the world.
And tell us, what is it?
So the PEPFAR program currently serves 20 million people living with HIV around the world with HIV treatment and millions more with HIV prevention. And this administration has frozen all of that money and has actually said that they're going to abolish the U.S. Agency for International Development that is responsible for administering much of that money. That is a massive crisis around the world for HIV programs. Right now, 3,000 people every day are getting infected with HIV. We have the medicines, and in fact, we have an amazing new medicine right now that you do twice a year, and it stops HIV infections almost completely. The PEPFAR program was about to roll that out around the world, and they've stopped all of that, and that is a huge crisis.
So Secretary of State Rubio is saying that he has given exception to PEPFAR by giving the waiver. What do you say to that?
So there's two things. First of all, what they've done is completely illegal. Actually, Congress is the one that enacted a law creating PEPFAR. They're the ones that created the United States Agency for International Development. It's actually not up to Secretary Rubio. It's not up to the president. And it's certainly not up to Elon Musk to decide to destroy that, to abolish that. That's actually a clear violation of Article 1 of the Constitution that actually says it's up to Congress. The waivers that are happening are similarly kind of silly, right? They've decided to freeze aid on the one hand and give a waiver for some programs on the other, while also laying off or freezing or putting on leave all of the people who are supposed to disseminate those waivers. You know, programs around the world don't actually run based on headlines. They run based on legal documents. They've received a freeze order. They've received a stop work order. And so slowly some programs are reopening, but many, many others around the world are not. We just heard from colleagues in Botswana who have a complete hold and freeze on all of their programs, despite Secretary Rubio insisting that they don't. And so this is chaos. It's mass chaos, and it's costing lives already.
Someone in the United States who feel like this might not affect them, what do you say to them?
So the HIV programs that matter for people around the world do several things. One, they help stop the AIDS pandemic that is raging around the world. Second, they bring a huge amount of positive political benefit to the United States, who's seen as supporting that. But third of all, these are also the programs that are also fighting pandemics. So on January 20th, when President Trump was being inaugurated, the government of Tanzania was announcing that there was an outbreak of Marburg. There's an outbreak of Ebola in the Democratic Republic of Congo this week, right now. Same in Uganda. These are efforts to stop pandemics that are now completely frozen, and they're saying that they're going to abolish. That makes Americans far less safe, far less strong. I'm not sure what the secretary thinks is going to accomplish here, but it's really, really damaging to U.S. standing and to U.S. security around the world.
How long are you planning, are all of you planning on being out here for and protesting? And can you just give us a sense of where we are right now and how we're stopping traffic?
So right now we're standing at the end of Constitution Avenue, right next to the State Department. Traffic is actually stopped to 5 different directions, going to Virginia, going to Maryland, and going into Washington, D.C. I don't know how long folks will be out here. I think they're really angry and really frustrated to see this happen. You know, the AIDS movement and the HIV movement was born of denial of access to services. And so this is just the beginning. They're standing in solidarity with people in Africa, Asia, and Latin America who don't have access to treatment, who need it immediately, or else they're going to die. So people are going to be out here for a while, I think.
Thank you so much. And can you say your first and last name and then spell it for us, and then also your title?
So I'm Matthew Kavanaugh, M-A-T-T-H-E-W, Kavanaugh, K-A-V-A-N-A-G-H, and I'm the director of the Center for Global Health Policy and Politics and a professor at Georgetown University.
Thank you.
Are you have another one right now, or okay? Do you want to switch sides?
Hello.
Let's be on the same side.
Or do you want?
And I'm gonna move
sorry.
it here.
Yeah, that's fine.
And this is my bike.
You could stand right there for me.
Sure.
And we're live right now.
Yes. Look at you.
I don't see it in the monitor. Screen.
Okay, so if you can say your first and last name for me.
So my name is Sharon Ann Lynch. Sharon Ann, S-H-A-R-O-N-N, R-O-N-A-N-N, Lynch, L-Y-N-C-H. I am one of many volunteers out here. I'm an AIDS activist with ACT UP, which is an AIDS advocacy group that has been around for decades. And I have to tell you, I am shocked to be back here. I'm shocked to be back in the place we were 24 years ago, trying to convince the government that people around the world need support, that it isn't right to let someone die simply because of where they were born, that we all benefit when people living with HIV can continue to live, can reduce the risk of transmission, can reduce development of TB and also the spread of TB. I cannot believe that we have been thrown back in time. You've got many people living with HIV who have been blocking traffic here, along with AIDS activists. And it's not about us. It is about the solidarity with the generations of people that we know that are alive today because of PEPFAR. We also know what will come once PEPFAR has its leg kicked out from under it. We've already seen and heard that clinics around the world have been shuttered, that life-saving medicines are staying in the cabinet, locked away, that people are being turned away from clinics when they come for their refills. This doesn't make any sense. This is posturing, political posturing, and putting millions of people's lives at stake. 26 million people are alive today because of PEPFAR. But that doesn't even speak to their family members that didn't get HIV because of PEPFAR. Their babies that didn't get HIV because of PEPFAR. Their family members and community members that didn't get TB because of PEPFAR. What are we doing? I have been working in some countries where the funeral homes were open, the mortuaries open 24 hours. Are we going to go back there? I have been working in places for HIV treatment programs in Africa where people come to the facility in a wheelbarrow. They'll come to clinic in the wheelbarrow because they are too sick to walk, too weak to walk. But I've also seen those people bounce back because of life-saving drugs, the antiretrovirals. If we don't have PEPFAR, then we're spitting in the face of science, but also punishing the success of more than 20 years of scaling up HIV treatment. And the US didn't do it alone, but the US smartly got other governments to invest, put the commitment and the political will and the funding on the line. But if they step back, then everything will collapse. It just doesn't make sense. All that needs to happen is the right communication from the State Department, from PEPFAR, and reversal, a course correction of the firing of these key officials that are responsible for providing this life-saving treatment to 26 million people.
Foreign aid ever got privatized somehow? What would you say to, like, what do you think about that?
We've already seen what happens where if you privatize healthcare, then there will be cherry picking of who gets funding. It won't be on merit. And also people will be forced to pay out of pocket. Because HIV treatment is lifelong, that is too much to put on the shoulders of people living with HIV around the world. HIV treatment has been part of the national government's response, largely because of the US government's support. If we back off, then we are telling them it's okay if you back off. If they back off, then it will only be those that are rich enough that can pay for the medicines themselves that will survive.
Anything else you'd like to add?
Just that it's a matter of time. One day without treatment means that the HIV virus escapes and attacks your body again. But you can extend that thinking to communities. I have been to places where one person in the school, one teacher survived out of many. What are we doing? We've already seen what it's like to not have treatment. So why in the world would we turn off the tap now? Thank you.
I'm gonna unplug that and then hand you the cable.
Rubio lies, people with AIDS die. 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 Rubio lies, stuff over there. Rubio lies, people with AIDS die. Rubio lies, people with AIDS die. Rubio lies. People with AIDS die. Rubio lies, 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 people with AIDS die.
It is what it is. It happens every once in a while. Every week.
How many entrances do they have?
Come on up, everyone.
There's employee entrances. There's a whole. I do. That building is too large.
Okay, come on up. If I could have folks' attention for just a minute.
Everyone.
So first of all, I want you all to give yourselves a big round of applause. There have only been a few times in my life when I've tried so hard to get arrested.
Right. That one. I can't believe
got
it.
physically picked up and thrown out of the street 3 times. And I said, well, why don't you just arrest me? And he said, I'm not going to.